Hi everyone, it's Liz here from Gather No Moss, and today I want to go through Colin's recent hip replacement operation. The reason that we want to cover this is, number one, it was in Spain, so that will help people who are having a hip operation in Spain. But also, when Colin knew he was having his hip operation, we decided to have a little look round on YouTube and see what advice we could get, what people were saying. And what we found is that there's a lot of good advice from professionals, surgeons, people who do the operations. Or there was advice from people who'd had hip operations, maybe 3, 4, 5 years ago, but there was nothing really up to date. So we decided that we would keep a record of how it all went. There's some funny bits in here as well, because we did try and keep things a little bit light-hearted to keep our spirits up. But it's an important major operation, and it has an effect both on the person that's having the operation and the person that's looking after that person. So I'm hoping that some of the advice that we're going to be giving you throughout this, and to see Colin's progress and how well he did actually do from the operation. We're a month on now, just to give you some encouragement and also useful information that you might be able to use. So we thought it'd be useful to cover some handy hints of things that we encountered as we went through the operation, and things that had happened to us or did happen to us or we needed or we found useful, just so that it would help you prepare in the future as well. So first of all, one of the things that we did do is, because we were in Spain, we were under ASA, which is our insurance company, and they were brilliant and looked after everything, but you don't get the same sort of facilities to things such as toilet seats, walking trolleys, crutches, things like that, that you would say as you would in the UK, and I know people do in the UK. So we knew that we had to prepare and get some stuff beforehand. And luckily for us, we have a local age concern, and they hire out equipment. So we were able to go and hire out a toilet seat raiser. I'll put a picture up here so you can see what the equipment's like, and also a pair of crutches. And because Colin is 6'3", so he needs long crutches, we had to make sure they were the right size. Also you can hire out trolleys, the walking trolleys as well. Now, we didn't bother getting that because Colin felt he'd be quite confident on the crutches, but I do think if you're a lady, we haven't got the same upper body strength as the men do, and a little walking trolley might be very useful. I know my mum's ill at the moment, and she's got a walking trolley, and she finds that great, and particularly with a tray on, because she can then make herself a cup of tea and walk back into the lounge quite easily with the cup of tea safe on the trolley. So we didn't bother getting one of those, but I think, say for example, if I had to have the operation, I would find something like that very useful. Other recommendations and things that you just don't think about, to be very honest, are you need, when I was picking Colin up from the hospital, he has to get into the car. Now, most cars, the seats are lower down. Now, when you come out after your hip operation, they have what they call the right angle rule, and you shouldn't be moving your hip and your leg higher than a right angle. So if you start trying to lift your leg up, that's when it starts hurting, and sometimes the hip joint can slip out. So I brought a great big cushion to put on the passenger seat in the car, so that he was able to get in the car and sit comfortably and lay his leg out in the sort of footwell of the car. So that's a real good top tip, I would say. Things like we had to use one of our garden chairs in the lounge, because again, our sofa's quite a low sofa. So if he'd sat on the sofa, his hip would have been further lower down and his knee would have been higher up, and he wouldn't have been able to sit comfortably. So again, we brought a garden chair in, put a big cushion on it, and he was able to sit in front of the TV in that chair. Not quite as comfortably, but it did the job for about a week, 10 days, whilst his bones were settling down and he was getting through the pain. Things like, as well, make sure you move. Because we live in Spain, we've got the tiled floors everywhere with carpets on. Move carpets where they're going to be walking, because they're such a hazard. So I had little carpets all around, with it, particularly with it being winter time at the moment. We have carpets just to try and keep it a bit warmer, but I had to move any that were in Colin's way for when he was using the crutches. So it's just preparing things like that really does help. A few other things as well. We have quite a high bed, so that was quite useful. I'll put a picture of Colin sat in bed. He was quite happy sitting in bed. But because he was in pain and he had to lie certain ways, what we found really worked is for me to stay in a spare bed. So I think we had thought it would be okay, but it was quite unrealistic, really. And it's very important that the person looking after, the carer that's looking after the person that's had the operation, gets some good sleep. Well, for me and my mood, it definitely is important. So I would say anticipate that probably for the first, it was maybe 2 weeks, I slept in a separate bed so that I could get a good night's sleep as well, because Colin was restless moving around. We got a cushion, and we got this cushion off Amazon. They are readily available, but they're a bit like the pregnancy cushions that people buy. So it's a right angle cushion. I'll put a link in our description about them. But that they work brilliantly, because you can put one under your leg and it props your leg up a little bit and helps you when you're sleeping. You can sort of snuggle into it. So I would strongly recommend those as well. Another thing that worked great for us here is that on our downstairs we do have a walk-in shower. So Colin was able to get into the shower and then I could shower him down. And that was a lot easier than having to step over into the bath area. You want to keep your wound dry, and you want to keep the bandaging dry to start with. And so it worked much better so that I could shower him down and he could soap himself down, but he still had the sides of the shower area so that he could hold on to those and give himself some support. So definitely, if you have got the accessibility to a walk-in shower, that will work really, really well. Initially, when it's still, you're trying to keep everything dry and it's still quite sore. So one of the other side effects that Colin found, particularly within the first week, I would say, is that he was feeling quite sicky at times. So he had to drink lots and lots of water. We did have some other soft drinks in as well, but we really stocked up with nice water for him, nice fresh water. And I was constantly bringing glasses of water for him. He wasn't drinking quite as much coffee and tea as he would normally. He just wanted water all the time, and he was drinking a lot. So I think that's a post-op thing, but just something to be aware of. And if you've got that sicky feeling, well, that's normal as well. So don't worry too much about that. He also found it easier using iPad and headphones and phone rather than watching a lot of TV. He didn't seem to be as interested in watching the TV. So keep those things near so there's some entertainment. Again, because of coming out of the hospital, he wasn't reading quite as much as we thought he would. He did do some reading, but not as much as he would normally do. So yeah, just a little bit so he could listen to music or podcasts. He downloaded quite a lot of podcasts. So another top tip really is to be doing that. I found as well, one of the top tips as somebody that was caring for someone that's just had an operation is have a friends and family update list or a WhatsApp group, because everybody wants to know how they're doing, and that is quite a time-consuming thing, typing up and messaging everyone. So again, if you have an update list of your friends and family, then you can keep posting out and keeping everyone in touch with how they're doing. So that would be a strong recommendation from me. Now, in Spain in particular, they do have different opening and closing hours for the pharmacies. And one thing that we nearly got caught on was when Colin was discharged, that day it was a bank holiday for all of the meds. And you have to go and buy your meds at the pharmacy. So luckily, we'd got enough paracetamol and stuff to tide us over for that first day, but we could have slipped up badly there. So if you are having an operation in somewhere that's where they don't have the pharmacies open quite as much as they would, say, in the UK, just make a note of your opening times for your pharmacies. I found the routine of providing the meds. I had to inject anticoagulant as well into Colin every day, particularly as we were due to be going back to the UK 2 weeks after his operation. So he gets a bit squeamish with injections, so I was doing that. But get yourself in a good routine, and I had them all laid out, and I knew what he was having and when he was having them. So I kept an eye on that so that the patient doesn't really have to monitor their own meds. If there's somebody caring for them, they can take that responsibility, and I did that, and I think that really helped him not having to think about that. And I just used to say, we need to do this now, or we need to do that now. So the med side of it, you need to be organised for that. And also in Spain, they don't give you loads and loads of bandages. So make sure you've got bandages, and particularly the larger size for the hip operation scar. So again, we had to go and buy quite a lot of those, just so that when we changed his bandages, which was turning into every other day, I would say, and then probably after about a week, it started to calm down a bit. But we kept his scar and his wound covered up until he had had some of the staples out. So we, just to give him extra padding there. So make sure you've got plenty of the big size bandages for that. Again, there'll be some pictures there to show you those different sizes of bandages that you need. He didn't have his stitches out until 2 weeks after his operation, and he only had half the stitches out then, or the staples, and then he had the other staples out about 4 days after that. So sometimes they don't take them all out at once, they just allow the wound to close a little bit more, and then they'll take the rest out. So again, just as a little bit of advice on that. I think one of the big things that I would really, really stress throughout all of the time of the operation, for the patient, for the carer, is really stress. It's very, very important to go easy on yourselves. Don't try and rush up and start doing things. I have to admit that I do like a nice clean house, and I do like everything in its place. But actually, it was really important to go easy on myself. It's quite stressful caring for somebody and looking after them, with the worry of them just having had that operation and making sure they're fine. So just go easy on yourself. If they're having a sleep, have a little sleep yourself. Make sure that you're doing what I call the 3 rules, which is sleeping properly, eating properly, and doing some exercise, whether you're the patient or the carer. So we really, really stuck to our meal times, made sure we slept whenever we felt like sleeping. So when Colin was sleeping, I would try and get a little doze in as well. And also Colin was very, very determined to do the exercises they'd asked him to do, and do a little bit of walking each day. Obviously, initially as the carer, you go along with them and you walk with them because you don't want them hurting themselves. So I was walking along with him. The biggest thing for me with Colin was that he wanted to do more than he should have been doing. So I had to keep saying to him, no, you need to stop and rest now. And no, you need your crutches. So he was very determined, but a little bit over enthusiastic. So that's a list of all of the helpful things that I would have liked somebody to tell us, and I hope that is useful if you're going in for a hip operation or if you're going to be looking after somebody that's had a hip replacement. Those are the up-to-date things that I think are important for the aftercare for the first month.